Hello there. It must be Martin, is that right?
That's
Yeah.
Martin, yeah.
And Martin's dad?
And Martin's dad, yeah.
Good. Okay. Well, I'm Dr. Baker. I haven't seen you, Martin, since you were about that big, I think. So,
Yeah,
how old are you now?
10.
10. Gosh. That...
Did his jabs before he went to school.
I
last time
can't
we
remember. I
saw.
think
Yeah,
it's a long
yeah,
time ago now.
Yeah.
But okay. Well, how can I help you both today?
Right, shall I tell him?
Yeah.
Yeah, well, he's been about 2 weeks now. He's been getting tummy pains, you know, and he's been off school with it. So I'm worried that
Sure.
it might be something a little bit more than just, you know, just an ordinary something a little bit more than just a normal tummy pain. You know,
Yeah,
it could be.
yeah.
Oh, I don't know, but you know, it might be something else. You hear about it, don't you? That, you know,
Sure.
it could
Okay.
be. I mean, it's not been a problem him being off school because I lost my job a while back, so
Right.
I'm actually sort of at home quite a bit now. So you know,
Yeah.
it's that's been okay, isn't it? It's not have to run around and try and find people to be
Sure.
with him. So that's not been a problem.
Can I just ask you a few questions, Martin, about
Yeah.
sort of what's happening and stuff at home and school? So, just remind me, what school are you at now?
Lady Bay.
Lady Bay School. I know that well. Who's your form teacher there?
Mr. Pearson.
Right. Yes, I've got some other children to look after. Who's Mr. Pearson's their form
Yeah.
tutor. He's quite nice. Is that right?
Yeah.
Good.
he's
Good. And I mean, how's school going at the moment?
It's going quite well.
Going quite well. Okay. And do you do any sort of hobbies or sports there?
Football.
Football. So you're into sort of football.
Yeah.
You probably support a team, do you?
Yeah, Spurs.
Spurs. Okay. All right. Never mind. Okay. Well. Tell me a bit more about this tummy pain you've been having then.
Well, it's kind of really bad in the mornings, but it kind of fades away and gets pretty much gone in the afternoon.
Okay. And where is it? Do you think you sort of point to the rough area where
It's
it is?
kind of in the middle, in the belly button.
Round your belly button, is it?
Yeah.
Okay. And is the pain? What's the pain like? Can you describe it?
It's kind of like queasy pain.
Okay. So it makes you feel a bit queasy, basically.
Yeah.
And do you have any? Does it cause you to feel anything else? Do you ever throw up at all with it?
No.
No. And what about the other end? What about when you sort of do a number 2?
No,
about-
that's fine.
That's fine. No kind of diet. I know it's a bit embarrassing to talk about, and I've got sort of people look after your age and when you ask these questions, but often they can have problems sometimes when you do a poo and it's very hard and
Yeah.
painful, or you have sort of quite loose and
No, it's not.
nothing like that at all.
No.
Then so that's all okay. And you look a fairly good weight and height there. Is it sort of everything okay with weight and
Yeah,
not
yes.
losing weight or anything like that?
No.
Yeah, he eats well. He eats for 2 people sometimes. He can
Good.
don't know where he sticks it all.
All right. Okay. And I mean, you're saying you had the pain in the mornings and also in the but better towards the end of the day.
Yeah.
Do you get the pain every day? What about sort of
Well,
weekend?
no, not on weekends. Every weekday, apart from some days in the week.
Okay, so it tends to be just the weekdays. All right. Well, I wonder if it might be a good idea now, perhaps, if we could just examine your tummy. Would that be all right? Because I think, just clarifying other things, I mean, you don't normally come to the surgery, so you're otherwise well, aren't you? And I think the next step would be just if I could just sort of lay my hand on your tummy and just have a gentle feel there. We can do that on the couch over there, and Dad can sort of sit next to you if that's all right. So should we do that now? And then,
Yeah.
Yeah? Okay, well, let's do that now then. Okay, well, the good news is I couldn't find anything to worry about there at all.
Okay.
Everything
good,
seems fine. So perhaps if I can just ask a little bit more about when the pain started, because it was about 2 weeks ago.
That's right. Yeah.
Perhaps I can ask you, Martin, has anything happened 2 weeks ago or changed 2 weeks ago that...
Well, at school, we have a new PE teacher, Miss Croft.
Right, and I've not heard of her, she must be new, so...
Yeah.
How's it been with her?
Well, she's quite strict about trainers during PE. You know, we're not allowed to wear anything other than that, and yeah, so she's not
Have you had a-
particularly nice.
So she's not very nice to you if you don't wear your trainers? And have you had a problem bringing your trainers in?
Yeah, I forgot them.
Okay. So has that caused a bit of upset at school then with her?
Yeah,
Doesn't sound like you both seem to get on.
no.
No. So what's happened with the trainers? Is that...
Well, you keep them at school, don't you,
Yeah,
in your bag? I mean, are they still there, or
no, I lost them.
you've lost them? Right.
I didn't think you'd be very happy with that.
Well, you know, trainers are trainers. If she'd said something about it, we could have sorted something out, couldn't we?
But I thought you might argue about that.
Well, because we haven't got much money at the moment. Me and Mum have had a row
Yeah.
about it. Don't be silly. That's just silly. We
Sorry.
would do that, would we? No, there's plenty of money to get you a new pair of trainers. You should have just said something.
Okay, sorry.
Mm.
Okay.
I mean, sometimes I have, so I look after sort of, people at school your age, and sometimes when you sort of get stressed and things happen at the school or home, you kind of get tummy aches and headaches, and I mean, it's possible that might be related, and that might explain a bit why you don't get them at the weekends as well.
Yeah. There's no school at the weekend, is there?
Yeah. What do you think about that?
Yeah.
Possible, is it?
Yeah.
Mm.
Well, look, can I suggest perhaps we see how things kind of go? Perhaps we'll see if Dad will get some new trainers from Miss Croft. Try and keep her happy, and then that'll hopefully make you a bit happier. And then we can perhaps see how things go with the abdominal, the tummy pain. And if things aren't settling down, then come back and see me. All right.
Okay.
But fingers crossed. I think hopefully we might see this tummy pain go away. So
Yeah, I think so too.
does that sound all right?
Yeah.
Mm-hmm.
Happy, Dad?
Yeah.
Happy?
Yeah.
Okay then.
Okay. Cheers.
All right.
Thank you.
Let's see you. Okay. Bye bye then.
Bye.